Hello, and welcome to Abby Tyler's Healthy Living. My name is Abby Tyler. I'm your host, a family nurse practitioner, a health and wellness blogger, and a community volunteer. In here, we discuss evidence based health information regarding mind, body, and soul with a holistic emphasis. Thanks for joining me on this journey of health and wellness. Please enjoy the show. Hello, 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 hello. Welcome to the Tuesday show. My name is Abby Tyler. I am your host, and welcome. We see the topic there: 10 symptoms you should not ignore. You should never ignore. So, let me get started. I am going to put on my glasses. How are you guys doing today? Hope all is well in your neck of the woods. And just give me 1 second here. I'm just going to share this for a minute. Okay, so and okay. Okay. Hello there again. Welcome. Okay. My name is Abby Tyler again. I am your host. As always, I'm going to give my disclaimer. I am a provider, but I'm not your provider. So whatever I say here should not take the place of you checking with your own provider. So please do not make any changes to your regimen without checking with your own provider. So let's get into it. Okay. 10 symptoms you should never ignore. Now, this is not to scare anybody because sometimes people hear this and they're like, oh my God, if I feel this, and that means something's going on with me, but it's just like a precautionary for you in order to see that. So let me just go in here and put my banners back up. Okay, so we'll start with that. And also getting this is not to scare anybody, just giving a warning, and also you know what to follow up with. Okay, so let's start. Okay, let me go in here. The first one is chest pain. Okay, like I told you guys before, sometimes some symptoms, some illnesses, they kind of mimic each other. The symptoms may mimic each other. You may be thinking you're having just heartburn, especially chest pain in women. When we're talking about heart attacks, sometimes with women, it doesn't just come with the chest pain you see on TV. Your chest pain, people are crushing, they're holding the chest, and you feel this sign right there. Whereas sometimes you could just be having like some little, you're having pain in the middle part of your chest, you're having pain coming down your neck and your jaw, and it's a little different in men than it is in women. So if you're having chest pain, you want to make sure tightening your chest or feel like something's sitting heavy on your chest. Excuse me for the light in there. Could be an indicator of a heart attack, and also could also be blood clots. So you want to make sure that you go emergency, call 911 and get to the emergency room as quickly as possible. Please do not go driving because you want to make sure. I always said before, you have the blood vessels in your heart and everything, and it may be closing up because that's where the blood and oxygen and everything is going through. The longer you sit in the car and you drive into the hospital, it's closing in and closing and closing in. You could completely, end up ending your life while you're driving to the hospital there. So, and you have to stop at the red light. You have, just in case anything going on the traffic. So call 911 and get to the hospital as quickly as possible. Okay, and that goes for whether it doesn't matter how old you are, you shouldn't be having any kind of crushing chest pain, you shouldn't be having pain that goes on. Some people don't usually go to the hospital right away. They'll say, well, yeah, I was having a pain here and there and nothing happened. And then I had the pain a couple of times and it didn't happen. So, this Haitian singer, I don't know him, I just got to know him after he had passed away. You saw him, they showed a video how he was going to go perform. He was on the station. You could tell that he didn't look that great and all that, but he went through and he performed and everything. And then going back at the end of the show, he just literally just fell down, just like dropped dead right there. I'm not saying that's always the case, but sometimes you get a warning long before and days before, and your heart's like telling you something and you need to listen to it. You know, something's not right there. So you want to make sure go and get checked. Okay. So I'm just going to look in here and do this. So number one, we said chest pain. All right. Number two, A sudden onset of severe headache, extreme pain in your head. Okay, particularly if it feels worse. Like we all know, you know your body, and you know from people who get migraine headaches or tension headaches, you know how it feels. You know the different migraine headaches. So you have sensitivity to light or sounds, or also like just different smell, the nausea, and everything that comes along with it. But you having a headache and it just feels different, and it just came all of a sudden because you know you usually have headache. It takes a little it builds up, but it just comes from really painful headache, and you're like, this is like the worst headache I've ever had in my life. Get and call 911 and get there, because usually that's like a sign you're having a stroke or aneurysm. Get there, 911, get there. Okay, now for people who live in areas where it's not you don't have 911, you just have to find a way to get to the hospital as quickly as possible. If there's a way you can call the police, or you can get a police escort, or whatever reasons. I'm talking about people who have 911 in, ability to get to the hospital as quickly as possible. There's some places in, in the United States, and some places in developed nations where people live in a rural area where they have to travel very far to get to the nearest hospital too. So I'm not just speaking on developing countries. I'm talking about just get this. So those are the things. So that's why it's important that you go into your doctors and getting your annual visit and all, so they can catch anything way ahead of time. There's something going on. Can be watching your blood pressure. Over time, if you come there with your blood pressure is high, we'll monitor on your medications. If we put your medication, we'll monitor other medical illness that can also contribute to a high blood pressure that may lead to a heart attack or a stroke. So that's why it's important that you go see your doctor annually and as recommended, as often as recommended. Okay, so a sudden extreme pain in your head, particularly if it feels worse, make sure you call. It's an indicator. Get to the doctors, the ER right away. Okay. Number three, sudden confusion or an inability to concentrate. Okay, serious indicator that something's very wrong. Like you sitting somewhere and you're like, oh my God, like I feel a little funny. I feel like I don't, what's going on with me. And somebody's asking you questions and you can't even understand, and things that you're driving somewhere or you're doing something and you just feel completely out. That's a sign that you need to get to the hospital, because sometimes, again, it could be a sign of a stroke. It could be a sign of an aneurysm. It could be something else. It could be a brain tumor. Sometimes, like some of those things don't have any warnings until like the very minute you start having pain. And then that's when you find out. I think I was watching something the other day where it's like this guy didn't, had no symptoms. Then he started complaining of a headache. And then he went to the hospital to find out he had brain tumor. Doesn't mean you may have brain tumor. And that's why I say don't diagnose yourself just by reading Google or listen to stories on the internet. Make sure you bring your doctor's attention. It's also always good to know your medical history too, because if your family member had severe, like a brain tumor or any kind of brain disease, or they had you had a stroke or anything, high blood pressure, you want to have that history. So when you go see your doctor, you'll be understand that. Okay. Also, you can be having a stroke. So because it's sign of confusion, it's not always, oh yeah, I have a major headache and I have weakness on my left side or weakness on one side of my body. You could be having a stroke. Certain confusion, or the bubble, the brain vessels may have bursted in your brain, and the point where it's not to where you're about to pass out here, and eventually that confusion may lead to that. Okay, so make sure you get that. And all you could be low blood sugar also if you're diabetic, or you may not be diabetic, but you haven't eaten and you're very low. And also could be in signs of infection too. So get to the emergency room. So at least, because if it's sudden confusion, all that too, if it's even if it's an infection, you may need IV antibiotics or IV fluids from dehydration. So you need to be there. You don't need to go to your doctor's office. You go to the emergency room. Okay. So number 4 is unexplained weight loss. Unexplained weight loss, about 5% of your body weight. Okay, so do your math and all that. So let's say, because when you start losing the weight, especially if you're exercising and you're losing the weight and all, and you're looking a little more fit, people say, "Oh, that looks good. You look good," and all. But if you're not exercising and you haven't been eating, not to say you're eating really bad, but you just notice that you're losing the weight, and people say, "Oh." And you won't notice it at first, but you start losing the weight over, and then you be like, "Wait a second, I'm not doing anything and I'm losing weight," and other people start saying, "You look like you're losing some weight." It's like, okay, if somebody hasn't seen you for a while, haven't seen you for a while, that's different. But people who see you all the time and say, "Your clothes looking a little loose on you," or you start feeling your clothes looking loose on you and you're not doing anything to lose that weight, that's a sign right there. Because usually when we start talking about unintentional weight loss, like if I weigh somebody when it comes for the follow-up visit, I'm like, you look like you lost about maybe 10 pounds there, or 5 to 10 pounds. Have you been doing anything? Are you on any weight loss program? Or is there something else going on? Sometimes people go into grief. They could be losing the weight too. So they're not trying to lose the weight, but they're losing the weight because of, grief and everything that's going on. So there are many other factors that can cause you to that can cause unexplained weight loss or unintentional weight loss. So, but if it's none of those things, then of course we'll start looking, because most of the time when you start losing weight, that's usually one of the main signs of we're looking at cancer. So especially when it comes to like colon cancer and any kind of different kind of cancer, it'll be like, okay, wait a second, what's going on there? Then we start asking you questions about different things that's going on in your body, and also keep an eye on that. Not saying go on a scale every 2 days and be making sure. And we come from a culture sometimes too, where it's like if you're fat, that means not fat or overweight or obese. I'm talking about clinically here, okay? I'm not offending anybody. And they might say, okay, there's something going on there. And also when you type 2 diabetes too, you can have honestly weight loss from type 2 diabetes. You may not know your diabetic status, so you need to get that checked. Depression and other things. And sometimes it could be your endocrine system. I told you guys the thyroid that works with you, that controls everything in your body, that could be a little off. So that needs to get checked too. Okay. So check on that. So number 5, if you're seeing flashes of light, okay. So let me just go in here. I think I moved my thing a little bit over. Seeing flashes of light and unexplained bright spots, like you sitting there and you're like, oh, okay, there's something going on my eye, and you start noticing it's a little different every time and seeing things go in. So anything that's different from your normal vision, like if you wear glasses, you say, okay, there's something going on there. But anything from your normal vision, you want to check, because that could be some like your retina, the part of your eyes that could be detached, and that can, if it does not check immediately, that can also cause permanent blindness. Okay, so the severe loss of your vision to where you become impaired. You may not be completely blind, but you may be legally blind. So you want to get that checked. And as usual, as always, I did a show on making sure your eyes are safe. So make sure you are going to your eye doctor at least once a year, especially if you have high blood pressure. If you have diabetes, you want to make sure you go see your eye doctor every year, and as often as they recommended. And also if you wear glasses, but normally you should be getting your eyes checked every year anyways, and making sure your glasses and everything, your prescription is up to date, because you can say, oh, I have my glasses now for about 2 to 3 years. And if you don't have insurance or stuff like that, it can be a little bit expensive or a little bit pricey. But most of these doctors know that they have so many different programs that you can get it at a cheaper rate. Okay, so making sure you get that. So if you see anything floating in your eyes and flashes of light where you're not looking at the light or driving somewhere, even if you're having difficulty driving at night, make sure you get that checked. All right. So number 6 is persistent fever. Okay, now you're not supposed to be having fever unless if you're sick. Okay, so even if you're sick and you're taking Tylenol, you're taking Motrin or anything you're taking for the fever, and it's not going down, that means your body's probably battling something that needs to get checked, something more serious infection. Okay, it could be something like a brain infection, meningitis, and you need to get the emergency room right away. Okay. It could also be something that's like urinary tract infection. And people say, okay, yeah, I got a UTI. That's when there's an infection in your bladder. If that's not checked, and that goes up to the kidneys, that can possibly damage the kidney over time, especially if you're like older person who already have your immune system is already impaired anyways, and you either have a difficulty fighting off diseases, or you have other issues that make it difficult to fight off diseases like diabetes and other things that impair your immune system. You want to get that checked. Okay. It could also be a different form of cancer also. It sounds like everything I'm saying tonight is a form of cancer, but you're not supposed to be having the body should be able to regulate itself, that you're not having persistent fever. You'd be like, I was feeling good a little bit last week, then I'm feeling a little, and a little fatigue, and I'm just not myself. There's something about me. I feel my skin and then warm there and there. So I want to get that checked. So make sure you get that checked. You may not have to go to the emergency room for that. You can call your family doctor, and they might say, okay, yes, go to the emergency room so they can do more testing. I mean, they have to do your blood work. You have to do some blood cultures on you and do some other things where you're going to have the infectious disease doctor there. You're going to have the lung doctors. All the different specialists will be there when you get there, so that you can be seen. At least they will admit you there for maybe a couple of days and run some other tests to make sure you are fine. You may be just fine, and maybe you're just going through something that didn't completely heal, but they can do that. Do a chest x-ray, making sure nothing's going on with your lungs and all. And for those people who have traveled outside the country, country and travel to places where there's a high rate of tuberculosis and things like that, and other infectious disease, of course, they're going to be asking you all those questions. So if you do travel from outside, regardless of whether it's a developing nation or not, you're still going to be around people. And even in America, I say, okay, did you travel somewhere else where you're around a lot of people recently? And then that's not going through your medical history and asking all those questions. So make sure you check with that too. Okay. So, and these are not in like, order of seriousness, by the way. So I'm getting next one is shortness of breath. Okay. So shortness of breath is much more important. It's up there with the chest pain and the severe headaches, but they're all kind of, this one's like more emergency too. Okay. There are many issues where you have shortness of breath. Let's say if you're exercising or you get a little short of breath, that's normal because the body's like, reacting to the fact that you're exercising, you're moving around. But if you can catch your breath for a long period of time and you're having chest pain and you got the dizziness and you're wheezing and you're gasping, I always tell people, like I used to tell even the new nurses that I trained before and everybody, I tell people every time, if you cannot breathe, nothing else matters. Okay. If you cannot breathe, just remember that. If you cannot breathe, nothing else matters. And I'm going to say that to all my people in the nursing field too, and everybody else who take, even whether you're a nurse or people who take care of people. If you cannot breathe, nothing else matters. Okay, nothing else. Get to the emergency room. 911, get there. Okay, you're staying there, and you also with that comes with the chest pain, confusion. But even if you don't have the chest pain, but you're sitting there, you're gasping, and you can barely. Sometimes the soul just bend your head down. Maybe you're having a panic attack. But what if you're not having a panic attack? You want to go get checked, okay? Because sometimes panic attack, you can pretty much kind of, like it's how you breathe into the bag or bend over and breathe a little bit, and it takes a few minutes, and you start finding yourself recovering. But when you're sitting there, you're panicking, and you're there, and you're wheezing, and you can't get the air out, and somebody, call 911. Get there. Okay. You don't want to wait. You don't want to wait because every time you're not breathing, every time the oxygen is not going to your heart, every time the oxygen is not going to your brain, things are being destroyed. And sometimes they may be irreversible. And unfortunately, they may end up in death. So you want to call 911 and get there as soon as possible. Okay. So, and again, like I said, it could be blood clot for people who take certain medications and all that. That could also cause like contraception or contraceptions, birth control pills, and other things too. That could cause your blood to clot. So you want to get there as soon as possible. I'm not saying anything against birth control pills, but I'm just talking about like younger people, younger women who take it, and even women in their 30s and 40s who take it too. That's one of the side effects that we talk about. So even if you're not on that, talk to your doctor. They can look at your risk factors and see if you have any other thing that would say, okay, yes, you can have these medications, but that you can take medication, and medications are pretty safe and all. But we also, when we prescribe these medications, we also give you the warning too. Okay. So it could be a blood clot, it could be all this stuff. So, but if you cannot breathe, if you don't take anything from this, what I said tonight, if you cannot breathe, nothing else matters. Okay. So call 911, get to the hospital as soon as possible. Alrighty, so the next one is swollen legs. Okay, so sometimes when we drive, some like for me, I drive like an hour to go to work, back and forth, and all that. So when I'm in the car, especially if you're driving, if you're driving, or if you in the passenger in the car or in a plane or anywhere that requires a longer period, maybe like an hour or so to go somewhere where you go in, make sure you're in the car, make sure you're moving your feet very frequently, even if you're driving, to make sure you're moving your feet very frequently, moving up and down, shake your toes, move it around very frequently, even if it's like every 30 minutes. Do that. Do not sit in the car and then you're not moving your feet for a long period of time, and what the blood is doing is just pooling at the back of on your feet there. Okay, so if you're sitting there and then for a long period of time, 3 to 4 hours, you're in the plane or you're driving somewhere, or a passenger in the car, and then you stand up. If you stand up and then that clot, and it forms a clot in your end, and if that breaks up, that goes all through your body there. Sometimes your feet are swollen, all, but if that goes up to your lungs, that's when that becomes real deadly, because it will always go through somewhere where you're going to block the air from going through. Okay, that can also travel to your brain too. So if you have swelling in your legs, also if you have some heart issues like congestive heart failure and some other circulation issues, diabetes and all, you want to go get checked, because sometimes it's like when you have some heart issues and they'll tell you weigh yourself every morning. If you take a medication that they tell you weigh yourself every morning, make sure you're weighing yourself every morning. You do yourself the same time every day. Have this skill on a flat surface. Get up in the morning, pee first. Don't take the medicine yet, and weigh yourself. And they just tell you, call the office if you see yourself gaining like 3 to 4 pounds over a 2 to 3 day period. You start having shortness of breath, do get that. Okay. So swollen legs would be like, again, heart failure, thyroid issues, vein problems. Some people who have also like varicose veins in the legs, that's like, you're not getting enough circulation going back and forth to your heart. Make sure you check with your doc, okay? And especially if it's hot and red and swollen, you want to go to the ER, because that's when it's like really okay. You say, okay, maybe that's just cellulitis, maybe just a little inflammation and everything that's going on your legs. No, it could be blood clot. So get to the hospital as soon as possible so you can get the ultrasound. So if it is, they can put you on some medicine and make sure to break up the clot so it doesn't travel to your brain or your lungs or your heart. Okay. So the next one is serious sudden abdominal pain. Okay. So definitely go to the emergency room, because you don't want to have any reason you had aortic aneurysm, a major artery in your heart there. You don't want that. If that bursts open, you dead. This is what's his name? I think he was on Martin. I think Tommy was in his Tommy. I think he died from aortic aneurysm. So if you're sitting somewhere and you have serious abdominal pain, you want to get the emergency room. It could also be depending on where your the pain is, because we have different diagnoses for what part of your body, what part of your stomach area. This whole part is the abdominal area. We call the whole body. It's like upper quadrant, this left side, right side, and where's the pain? We tell you what's the pain. Is it the left side? Is it on the right side? So the bottom part is it lower than your belly, because you could also be having pelvic pain too. What if you're a female that's having like severe pain? Let's say you're sexually active and you have like sudden pain, and then you're thinking, okay, did you get your period? Did you not get your period? That you could have like the baby forming into the fallopian tube. That's like a tiny little hair, as thin as a hair, and you're having this egg that's forming there when it's supposed to be forming in your womb, which is your uterus. So you want to make severe sudden pain. It could be appendicitis, it could be your gallbladder, it could be anything. But if it's severe and sudden and all, you want to get to the emergency room to get that checked right away. Okay. And if you are pregnant and that pain is there, let's say I missed my period, and yes, I'm happy I'm pregnant, but that pain shows a way in the pelvic area that I'm talking about way below, that you want to get that checked, because if that breaks open, you could die. So make sure you get there. Okay. And let me see here. And I think I got all of that there. And finally, excessive fatigue. Okay, this one you don't have to go to the emergency room. Okay, you feel tired all the time, but it's like you're getting up and you're moving around. Like I said, for some people like me, this time of the year, with the sun going down and there's not daylight, often it's not hot. That's like, I'm like, oh God. So I have to do things to make myself like have the lighting and all that going on, because it's like, okay, the weather changes in the weather. This year I'm doing a lot better. I'm like enjoying all the fall colors, and I'm doing things like appreciating fall, because it's like, okay, appreciating fall, because again, my thing is summer and all that. Once it's hot, I don't care how hot it is, as long as it's hot. Even if I'm inside, as long as it's hot, I'm good. Okay. But so you want, and you're just feeling kind of tired, and your appetite is a little poor, and you're like, okay, well, and it's like you're not drinking that much, you're not peeing that much, and you just feel totally different, and your stomach feel kind of, it's like, I don't know, it just feels kind of funny. I know myself, and this is not how I am. I usually get up and go do my work, but nowadays I do my work and I just want to sit down. I do this and I get very tired easily. There's something going on with me there. It could be the fact that your vitamin D level is just a little low because there's not enough sunlight. Some people have really critical low vitamin D level, and it's chronic, and it needs to be a vitamin D supplement. It could be also be like you're losing blood somewhere. Okay, so you want to get that check. It could be some other form of, your thyroid disease also, because again, like I said, the thyroid controls everything in your body. So as soon as if it's like high or low, it could be that I told you the anemia. So you may want to get that check. It could be also depression. Sometimes it's like a seasonal effect disorder where it's like, okay, you get depressed a certain time of the year. It could be the fact that, maybe like if you had a traumatic event around this time of the year. And so whenever this time of the year comes around, you seem to get a little, you be like, then well, actually, do you usually get sick? Do you usually get tired around this time of the year? Do you find yourself not wanting to go out this time of the year because of whatever is going on? And then you start thinking back about it. But at the same time, you want to make sure that you get the blood work, because we always try to get the medical part out of the way. We also talk about the mental health part, but we want to get the medical part out of the way, because that's the one where if you were in the hospital and you were anemic, the psychiatrist may come and see you, but you still have to be medically cleared if we're discharging you over to go follow with a psychiatrist or whatever. We want to make sure the things that are going to cause your life and livelihood right now, we take care of that first. Okay. So just bring it up and just say, yeah, even if you have been to the doctor maybe 3 months or anything can happen during that time. Something could have been developing that wasn't found when you were there earlier. So bring that to your doctor's attention. Okay. So I think I went through everything. For those of you who are watching me, I did everything that's always on the screen. And let me just go back here. So just to go back on chest pain, signs of don't ignore your chest pain, sudden onset of extreme pain in your head or severe headache, sudden confusion or inability to concentrate, unexplained weight loss, about 5%, and like I said, unintentional weight loss as well, and seeing flashes of light. Persistent fever, which is not supposed to be happening if you're okay, shortness of breath. Remember what I said. If you cannot breathe, nothing else matters. Okay. And swelling legs, making sure there's nothing going on your feet there, no swelling, there's no blood clot in your legs. Serious and sudden pain in your stomach, pelvic area, and excessive fatigue. Okay, excessive fatigue, also being very tired. All right, so that's not it. This is not a comprehensive list. I just put all this other stuff together so you follow up from there. Okay, so again, you know yourself, you know your body. Like when people come, to come and see me and all, I say, you know yourself. Is this something that's different for you? Okay, and how long have you been feeling this way? Again, we go and ask the same question: when did it start? How long does it last? Have you done anything to help yourself yet? What have you done? What's going on in your life and all that? Because somebody may say, I got something. I'll be like, what was going on and when that started? So that's how we start getting all this different information in order to come up with a diagnosis. Okay, so let me just see here. Alrighty. Let's read some of the comments here. Okay, I was Lisa is watching from Liberia. Hello, thank you for watching. And Jenkins says, so true. Thank you. Donna and Jola, well, thank you, thank you, thank you, thank you. And any first aid for shortness of breath or breathing issues? Well, if you have anything, if you have like if asthma, especially for people who have asthma and things like that, we usually give them their rescue inhaler. So if they have any shortness of breath, they usually use their rescue inhaler and taking like two puffs, and it's like every 6 hours. So, but if that doesn't, sometimes we tell you breathe in, especially if it's like, if you have panic attack, or breathe into the back because you breathe in back and breathing out. That because if you went to the hospital or you call 911, we're going to put the mask on you that has this all closed. It's called non-rebreather. So you're breathing there, breathing the forced air is coming back into your body and all. But usually, most important thing is get to the hospital as fast as possible. They will tell you, if the person's there with you, kind of make them relax them a little bit, because anything that causes them to relax a little bit can also open up the airways so the oxygen can flow through. So as long as you keep them calm and just say, okay, oxygen, this person cannot breathe. Usually the ambulance should be there very soon. Okay. But before you start getting into that, you'll start having signs of different things going on with you. So it's very important that you listen to your body. When your body's different, something's going on, they'll tell you. Not everything has any signs and symptoms, but usually you don't just, if it's that happens so suddenly, then definitely get. But if somebody's with you and all, make sure that person keeping you calm, okay, and just breathe. I used to tell people when they're breathing, when it's like when they start heaving, and I'm like, okay, breathing, like, purposefully breathing. Okay, you hold your breathe, put it in and then breathe out slowly. It's like almost like you're taking the gulp and then you're breathing out. Breathe slowly out. So like just breathe like a little flower away. Breathe a little flower away. So just do that. So you keeping them calm at the same time you're doing that. But at the same time, while you're doing that, you've already called 911. Remember, call 911 before you start doing that. Let somebody stay with that person and keep them calm and call 911. If that person hasn't passed out and all that, you cannot do anything. You cannot do like compression or nothing like that. Once that person is still breathing, try to keep them calm as much as possible. And if they have asthma or like, any kind of lung disease that require their rescue inhaler, they can use that. Okay. And Jackie Jackson said, what about people traveling those long flights? Again, yes, I went back to long flights. If you have any issue, especially for some people who already have like clotting issue, usually bring it up to your doctors, because sometimes they can tell you, okay, take some medicine, take some extra medicine. That you're going to take that so to keep your blood nice and thin. So when you're sitting there for a long period of time, even if you're on a plane and even if it means standing up in place, stand up, move your feet. And when you're sitting down, move your feet as much as possible. Like if you're sitting down and marching in place, do that, move your feet up and down, stand up for every hour. If like 4 to 5 hours, stand up every hour, move all your limbs and all that. Do that very, very. But if you feel funny when you when you arrive to where you are, where your legs are so numb and you're not moving around, make sure you tell them, so they can call so you can go to the hospital. Because again, if you haven't moved around for 5 hours and your legs feel kind of numb and you're feeling funny, you don't want that clot breaking and go into your brain or to your lungs and all that, okay, to your heart. So again, every 30 minutes or an hour or so, and then talk to your doctor if it's safe for you to have really long flights, because it may be cheaper to have like a straight flight somewhere, or you have to break up your flight from here and there. I mean, you may have to drive somewhere where you can stop very frequently and use the bathroom, because you're getting up. Even if you have to, like, 2 hours, get up, stop on the side of the road, move your feet where it's safe. Now, don't just stop there. Anywhere where it's safe to move your base. It's very important that you're moving your body, your feet back and forth, back and forth. And for those of you, us who drive every day and all, even when I'm driving the car in the morning, I'm moving my feet very frequently. I move it like very frequently up and down. Okay. And if you notice any swelling, of course, get help. Okay. And Evie said, "Thanks for the good tips, Abby." Oh, thanks, Evie. How you doing? We're done with, so I was like getting ready for all this different stuff that fall. We'll just get past the holiday and go into the next one. But thanks to all of you for watching. Like again, I said, this is not a comprehensive list. Okay, so speak to your doctor, go to your doctor every year like you're supposed to for your annual visit. And also, if they tell you to follow up with other specialists, make sure you do that. Get your blood work. There are a lot of diseases out there that have no symptoms until it's too late. Make sure you get all your screenings, and also at least you have a baseline about your health situation. So if any of those things happen and you may not have any history, and something can happen anyways because it's just something you brought, your genes, or something else is going on. So all right. So I hope you guys enjoyed this show. If you did, please give me a thumbs up. Please share it. Again, you and I may not have the same set of friends. So if you share it, somebody else can see it, share it, and also try to invite other people to join, because I'm still trying to get to 1,000 before December. Fingers crossed. But also, so give me a thumbs up, any sign there. And also, for everybody who's celebrating their birthday, happy November. Everybody who's celebrating their birthday in November, happy birthday. I'm going to be a little selfish and say, yes, I'm one of those people celebrating my birthday in November, and tomorrow is my birthday. So anyway, but I'm happy to 365 days around the sun, right? So, but happy birthday to everybody celebrating their birthday in November. Early November is like Scorpio season, all right, so we master it is so passive aggression. No, but we're good. We're just good. We're sometimes we're misunderstood as Scorpios. But anyways, I just want to say thank you all for watching. Let me see here. Thank you. That is thank you all for watching. I really appreciate it. And share the show. And I will be back Friday. Okay, hopefully. And good night. Thanks to all for watching, and I will talk to you guys later. Good night and God bless.